and Hannah. You guys are on.
We're on, okay.
You gals.
So, how's the volume?
Just talk loudly.
Just talk loudly, okay.
Well, we can hear you, but for the audience.
Yes, they have a hard time hearing.
Yeah. I mean,
They have a hard time hearing us, too.
the global
The
audience.
global audience, okay. So
The international audience.
we will share this then. So this is our annual wrap-up of 2019. Every time I come to this slide, I'm always kind of happily amazed that this partnership has been going since 1998. I think that speaks to we're doing something right and it's working well. So it's a combination of the Cook County Public Health and Human Services as the clinic, and then there's programs within that, Child and Teen Health, WIC, and then SHIP. I always like to start, though, to kind of ground us in, get us all on the same page about when we're talking about health, what we're actually talking about. So we each have individual factors that impact our health. We're all a certain age. We were born with specific bits. We have genetics that vary from person to person. That's who we are as individuals. And then we have individual behaviors that we engage in. We eat different things. We move our bodies in different ways. And those individual factors and individual behaviors take place within an infrastructure of where we live. So some of us are fortunate to live in a place where we can walk outside our door and be in the biggest park you can imagine. Some folks don't have that opportunity. Some people live where there's really good public transportation and they can just hop on a bus or a train and get where they need to go. We have a harder time sometimes getting to Duluth, places like that. Well, the individual factors, the individual behaviors, the infrastructure, those take place in another overarching environment of our living and working conditions. What is the housing like? What are the job opportunities like? Is it noisy? All of those things then filter down and impact the individual as well. And lastly, the individual factors, individual behavior, infrastructure, living and working conditions happen under the umbrella of the social, economic, and political factors. Is an individual having to cope with racism, segregation, inequality, poverty? Because all of that filters down and impacts the individual. It's what we refer to as the social determinants of health. So our community health outreach program happens within that rainbow, and this is what it's looked like for us over the last year. We had 590 direct client or patient contacts. Our online reach was over 84,000, almost 85,000. Now, some of these were very direct, such as the blood pressure and blood sugar screenings that usually it's Denise Axtell that goes out and does that, but sometimes it's another nurse. And she worked with 140 patients, and there were 163. So some folks had both their blood pressure and their blood sugar done. So she also does foot care. She took care of 142 people last year, and that is she is a real blessing to the folks that she interacts with. Hannah will be talking in a little bit about the maternal and child health and childbirth, but that impacted 141 individuals. Chris Angelo teaches our Living Well classes. This year it was with chronic conditions, and there were 14 folks that went through that class. It's a 6-week class for people that have an ongoing health condition to help them live the best that they can with that fact. And then Christine Kunze is our car seat technician, and so she worked with 15 families to help make sure that their babies and little ones were strapped in safely like they needed to be. This year we did something a little different. With the hot potatoes and tater tots, it's parenting when things get hot. Over the preceding years, we've seen numbers in classroom presentations really drop. And I think that that's because 20 years ago, when the Hot Potatoes program first started, the internet was not what it is today. So if you wanted information about communicating with your teen, you had to be there on that night in that class, and that's no longer the case. Now, if you want to know something, you can Google it. You can go to YouTube. You can find a video. So people just don't have to show up for classes anymore in the same way. So we're trying things a little differently. This year, we did something called Teens Questions, Doctors Answers. And we got a selection of questions that providers and nurses have heard from teenagers over the years, wrote them up, and then two of our doctors, Dr. Hansen and Dr. Farshman, answered these questions from teenagers. So we recorded it, and then we put it up on YouTube and Facebook. It was well received, but not with the demographic I was going for. So middle-aged women loved this, but teenagers did not watch it. So you'll see how we're continuing to hone our outreach in that.
Do you think if it was interactive, the teenagers would participate?
Tell me
Rather
more.
than being pre-recorded, if you had it live, which could be a little scary.
Which could be a little scary. Yeah, I don't know. I'm willing to try that if I could get some teenagers that would be willing to ask
I've
questions.
got one for
You got, okay. We'll see what we can do. So, but even though, in spite of all that, we had it was viewed 238 times and has been watched for over 1,100 minutes. We did have a classroom class with Mary Zabracki. She is our registered dietitian that comes up from St. Luke's 2 days a month. And she did a class on carb confusion that we had 10 actual human warm bodies attend and sit in the class. We had 4 people watch over the live stream. We've since had 396 archived video views, and it's been watched for over 316 minutes. So that was a success. The very end of the year, last year, I led some grocery store tours. I didn't think it was going to be really well attended because it was in December, and who has time to do anything in December? But it did allow me to get the program together, and I just ran it again. We had 3 tours here in January, so you're going to have to wait till next year to find out about the numbers, but we had much better attendance this time around. We also reach out through traditional media, and perhaps the most impactful component of that is the Topic of the Month newsletter. We currently have 192 email subscribers, but then there is a secondary mailings that go out. For instance, it goes out to all the county employees after it lands here, then it gets sent out. Same thing happens at ISD 166. GES sends it out again, so there's a secondary ring out. We have almost 19,000 possible patient exposures of hard copies of folks that come through the clinic. They're always in the exam rooms and out in the waiting area. 352 views came through the Sawtooth Mountain Clinic website, so people logged in through our website to read it 352 times. And then it is posted on the front page of Boreal. And they have over 19,000 users a month, but I don't have any way of knowing of those visitors to Boreal how many people then continue on, but it's there. I am on the radio once a month to talk about the topic of the month, but there again, there's no way to know how many people hear that. Amy Sue Schmidt writes an article every month for Northern Wilds, and they have between 14,000 and 20,000 readers a month. And then this last year I wrote 6 articles for the News Herald, and they have about 4,000 subscribers. So we had 24,000 possible exposures of those articles. New media, that's things like Facebook and YouTube and that kind of thing. We have a Facebook page for the clinic. We have 660 followers, and our posts reached almost 64,000 people last year. I got curious as to what were the posts that were hottest. And so I went back and I looked at things that had over a reach of over 400 organic, not that I paid for. And we had 6. And I'm not going to say that went viral because I think that's too big a word, but there were 6 that had over 400, a reach of over 400 organically. The one that says WIC, that was number 1, and it had a reach of over 900. That came out when the government shut down last winter, and there was a lot of concern over would WIC still be available for people. So I interpret that big reach as panic, actually. Will I still be able to, will my benefits still work? And the second, where you can see the 2 people talking, that had a reach of over 600. The topic of that was, how can I engage with someone that has different political views than me and have it still be a respectful, caring interaction? So the fact that that was that big speaks to me and says that people are concerned about that. Regardless of what we hear, people still want to be able to engage with other people. And just thought those 2 things interested me. We added 100 followers and doubled our post reach from 2018. The local food market has a Facebook page that I take care of through my ship time. We have 113 followers, and our posts reached over 2,300 people. Any questions about traditional or new media or any of the other outreach things before we get to WIC?
Okay, since you're taking a break, Kate is here. Please come forward and hang out with your wonderful staff. And just so everyone knows, this is Kate from Sawtooth Mountain Clinic. I don't know if you've been before us yet or not.
We did when before Rita left. We had a little meet and greet, and I think I've met everybody before. So
we've got two members up here, Andrea and Roger, are new to this board. So thank you for joining us today.
Drive.
All right, I'll do it for you.
Sure.
Okay.
Teamwork.
Yeah. And since I don't believe I've met all of you, I'll introduce myself as Hannah Miller. I'm a maternal child health nurse at the clinic. I do home visiting and WIC, prenatal education, childbirth education. And I'll talk a little bit today about WIC and home visiting in particular, starting with a basic overview of what the WIC program is and does. It's a USDA federal program that is administered through the states and local agencies. It serves, maybe I should drive. It serves a target population of pregnant, expecting parents and children through infancy up to age 5. It offers food support in a tactile way, food vouchers that are specific to foods that are often missed in the average American diet, specifically targeting those nutrients. And nutrition education every 3 months for enrolled participants can be either by phone call check-in. At least twice a year we check in with people in face-to-face and take measurements of height and weight and hemoglobin, measuring possible anemia or iron deficiencies in children and in pregnancy. Breastfeeding support comes in multiple forms, both as part of that quarterly nutrition education, but also as needed prenatal education for lactation and through the peer support program. We have a peer breastfeeding counselor, a mom herself who has breastfed her kids, been on WIC, and is there as a champion and cheerleader for people who have questions and need to reach somebody outside of office hours. I act as the WIC coordinator. We have one other WIC staff member doing the nutrition education, which is Amy Schmidt. Corin Goldstrand is our clerk, and Christina Rittelbauer is our peer counselor. She averages about 10 to 13 clients a year which she follows through text and phone calls, and she also shows up on our WIC day. Though we offer appointments anytime as needed, we have an official WIC day the second Tuesday of the month where people can drop in, see Bonnie from the Oral Health Task Force and talk about dental care, see Christina Riddlebauer if they have questions about breastfeeding, and engage in the community in that way. In 2019 enrollment for WIC, we had 79 households and a total of 134 participants. In all of our screenings for hemoglobin, we identified 7 cases of low hemoglobin, which can be an issue for brain development, especially in those birth to 5 years. So we completed referrals to primary care, the beauty of WIC being lodged in the primary care setting of the Sawtooth Mountain Clinic, making that particularly manageable. Breastfeeding rates for WIC participants ever breastfed, so an infant who was born and breastfed at least once was 100%, and breastfeeding rates at 6 months for our WIC participants in Cook County was 70%, which exceeds the Healthy People 2020 objective of at least 60% following breastfeeding until 6 months. Yeah.
I have a question. Is there any, do we know reasons why it drops, or why it's, ever is 100% awesome?
Mm-hmm.
And do we have any, do we know anything why it goes down to 70%, like what barriers there are?
It is a statewide and nationwide phenomenon that people will often start out thinking, give it a try. We'll see if it works for our lifestyle. There are many barriers to breastfeeding through. The 1-year mark is what the American Academy of Pediatrics recommends for breastfeeding. But barriers to successful breastfeeding, many are return to work is a big issue, people pumping, lack of social support. There's not a lot of visible breastfeeding going on in parks and public places, so it's not a cultural norm yet, though that's something that we're working on. And the number one determinant of success for meeting a breastfeeding goal is a supportive partner. So that's something that we're working on with WIC as well, is to try to engage and invite partners to come for lactation education and really understand what's in it for their family and why they might pursue that. So just looking at how we're doing in Cook County compared to the rest of the state, we're finishing a year here, 2019, but we're also finishing a decade. So I thought I'd pull up this map that shows 2013 and 2016. We are the darkest region in the state, meaning that we have the greatest success with breastfeeding. This is at 6 months that we have over 60% is the threshold, because that's the 2020 goal. But we've had successfully exceeded that, both of these benchmarks in the last decade and again this past year. So checking in on how we're doing reaching folks to get enrollment in WIC. This is something that we will bring up in prenatal visits when I reach out to folks who are getting care at the clinic. Hartley does research at the Healthy Children Fair. And I just wanted to check in to see how we're doing. Does it seem like we're meeting the numbers? So I did a little bit of math just to see where we're at. And it looks like we're doing really well. It's hard to really get a picture of if we're reaching everybody who would be eligible for WIC. There are eligibility requirements for income and, of course, the age factor. But it appears that if we figure out how many people might be eligible based on how many people there are birth to 5 in the county, what % of those people live in poverty, it looks like we are almost double what we would expect. And that might be in part to these old census numbers, but it might also be the fact that we are able to serve a wider region. You don't have to live in the county to be on WIC here. You might live in Grand Portage, you might live in Lake County and travel here for care at the clinic and find WIC convenient that way. So it seems like we are doing a pretty good job reaching everybody. The one potential outreach target for 2020 would be to to find children who have moved to Cook County. If we're reaching people specifically prenatally, this may remain as a gap.
Excuse me, do your
Yes.
numbers include the folks that are seen at Grand Portage for WIC as part of it, or are they separate?
That would be a separate, they have a separate WIC agency, and certainly people who live in Grand Portage can have their WIC enrollment here, and then they would be counted, but if they are seen for WIC in Grand Portage, they would be counted separately.
Thank you.
Any other questions about WIC before I move to home visiting? The home visiting is new to the clinic as of the last year, having taken it on. The purpose of the program to support caregivers both prenatally and postpartum. There are pieces of it that are physical, psychosocial assessment, connection to resources, health education, and the supportive relationship of having somebody come to your home and listen to what you're going through and be a connection point for you. This program is offered to all expectant parents in Cook County. We get our referrals through primary care at Sawtooth Mountain Clinic, self-referral, and then if we haven't reached everybody prenatally, we can at least reach out postpartum through access to the Minnesota Department of Health birth records. We have 2 programs for home visiting. The first is universal home visiting, which is extremely flexible based on the needs of the participants. Can be anybody prenatal through age 3, and there are no specific eligibility requirements other than living in Cook County, and it is free to participate. In 2019, we had 4 prenatal patients, 26 postpartum, and 28 babies and children served by universal home visiting. The other branch of home visiting at the clinic, apart from universal home visiting, is Healthy Families America. This is an evidence-based home visiting program that we just started in this past year. It is focused on preventing child abuse and neglect through fostering parent-child attachment, and it uses an evidence-based curriculum called Growing Great Kids, which some people will know from early Head Start programs also use that curriculum. The enrollment for this evidence-based program is a little stricter than universal home visiting. It is targets people prenatally for enrollment and then has regularly scheduled visits up until the child is 3. So in that first 6 months in particular, the minimum frequency is weekly, so it's a highly intensive program. With an income eligibility requirement, if you're on medical assistance or WIC, you would be eligible for this, and 1 or more additional risk factors that make you a candidate for extra support. 2019 saw the completion of training for this program for me, and we are now enrolling families for 2020.
Why is the caseload maximum of 5?
As an evidence-based program, it has come to light that with a maximum caseload, the intensity and the relationships can be focused on most effectively when there's a limited maximum. Is that a clear answer?
Yeah. So if there's more than 5, they're just out of luck?
Then we would offer them universal home visiting.
Okay.
And because I do both programs, the knowledge that I have and can share is available to anybody who's doing any kind of home visiting program. They would not have the benefit of contributing to the evidence and the statistics of this home visiting program, and they may not be encouraged in the same way to really follow through on the frequency of visits, but if that's something that they're interested in, it's certainly available.
Excellent.
Yeah. That is all for home visiting. Are there any other questions before we move back to Hartley with child and teen checkups?
Thank you.
Yeah.
Okay, the Child and Teen Checkups, it's funded through the state of Minnesota, and it comes through the Department of Human Services, then the Community Health Board, and then to you guys, and then to the clinic. Then we send quarterly reports back up the pipeline the other direction. The focus is on patients birth to 21 who have Medicaid or Minnesota Care as their insurance. They get reminder letters to help them stay plugged in and coming on a regular basis. And then we go out to the community, to the Grand Portage Health Fair, Family Day at the Y, Open House at ISD 166, just to keep it in front of parents' minds that checkups are still important. Even if your kid is strapping and strong and doing well, it's still important to get them in on a regular basis. So part of our outreach this last year was an Instagram video series that we finished production in December, and they're now being disseminated through Instagram. We took back the slide I showed you earlier with the teens' questions. We took those same questions that our two doctors answered, and then condensed the answers further. And a teen then presents them. So it's the same information. He's not making up anything new, but he's a kid, and I think quite a handsome young man. He's also my son, so I can say that. It was finished in 2019, and they're now being released. The fourth in the series was posted 2 days ago. So if you're on Instagram and you haven't seen them yet, I encourage you to check them out. I don't have, I'll have numbers for you for the series at next year's report, but I can tell you that way more kids are seeing this than saw the YouTube series. So, because then my son puts it up on his Instagram, so I asked him this morning, and I'm learning. I did not do Instagram before this, so the learning curve has been rather steep. But I asked him this morning, how many people saw your story for the last video? And he went and checked, and I think he said 89. So, and that's almost exclusively teenagers, almost exclusively from Cook County High School. So I feel like this has been impactful. SHIP. We have our intrepid coordinator here with us, and I think this is important. We talk about making the healthy choice the easy choice, but there's something that has to happen before that. It has to be possible. If it's not even possible, then it can't be easy. So all SHIP programming is required to work in their local school. And then but what that looks like is not handed down from on high. And then what arenas they choose to work in addition to that is in response to community needs. So here, in addition to working with schools, there's also an active living component and a food access component. That's one of the, I think, one of the real strengths of SHIP is that there's so much latitude and so much creativity for what works in your place. Let's give it a shot and see. So there's some big general parameters, but it's really very sensitive to the needs of the community. And they look at policy, systems, and environment. So you're not going to see programmatic things come out of SHIP. They're really, really interested in changing the underpinnings of policy, systems, and environments versus let's do a wellness fair and get information out. That's not a SHIP kind of approach. So for the active living, now Andrea, you jump in and tell me if I leave anything out. Safe routes to school is a biggie. There was in spring of 2019 a third grade in-school bike ed. So we want kids to be more active. We want them riding their bikes to school, but we want them to also be able to do that safely. Part of that was the bike rodeo. There were 21 volunteers, 71 kids came through, and 32 helmets given away. So that's a lot of noggins being protected. There's also a partnership with the city in looking at the T21, the Tobacco 21 initiative, which is still, even though there was some federal action taken on that. There's still work that needs to be done at the local level. We're so appreciative of the county's support of that. And people, local, and it's not just us that need to look at it from a specific city level. That's still happening all over the state and the country. There's also a pedestrian plan, and then the Active Living Steering Committee has been involved in revisioning what is that, who are we, and what do we want to do, and how do we want to do it. So in the school arena, there is a weekly walk to school group when the weather is warmer. So every Wednesday, kids and families can gather together and enjoy walking together in the morning. Andrea is a member of the ISD 166 Wellness Committee, and then there's also a new great lunch. There's shifts happening around that at GES that she's involved in. So Andrea did a survey in 2019 to look at specifically the safe routes information. And I know that's hard for you to see, so I'll tell you what the small numbers say. So the student, 76%, that's the student travel tallies, showed the number of students walking or biking in 2019 increased by 76% from 2018. What are the barriers to walking? Distance. We have a lot of kids that come from really far away, and so that's not always an option. We are hopeful that at least on walks to school Wednesdays, maybe they get dropped off at one of the pickup points and then walk the rest of the way, even if they're coming from pretty far. Time, safety of intersections, supervision, the weather here can be dicey, and then the speed and the amount of traffic. Sometimes folks just don't feel comfortable having their kids walk where it's feels like the traffic's moving too quickly. Safe routes to school is impactful by doing safety assessments and community input. There are walking school buses that are nice to be a part of. There's a nice clear map for if somebody wanted to see the routes. There's the bike rodeo, there's in-school educational programs and flyers, and then there's the work that happens at the infrastructural level too, in local policies and working with families, officials, and stakeholders. So the Walk and Roll Wednesdays are a parent-led weekly walking group, so the kids have some adult supervision, especially if they're littler. There were 119 participants last year between March 3rd and May 29. 86 kids and 33 adults walked or biked to school. And this is the last bit of SHIP. This is the part that I'm active in, and that's the food, healthy, affordable food access. This is a picture from the local food market on Thursdays. It happens at the Cook County Community Center. This year we averaged 6 vendors a week with about 50 to 70 shoppers. We tried something new this year, weekly cooking demos. So either the board members of the Northwoods Food Project or the vendors themselves sometimes pitched in and did a little cooking demonstration, and that was well received. People enjoyed that, and I mean, who doesn't enjoy getting to go and have some tasty things to nibble on while you're shopping? So it will be happening again.
Just ignore that.
Okay.
It'll disappear.
This next spring, it'll be starting in, it'll go mid-June through mid-October. We don't have specific dates yet, but that's a ballpark. Any SHIP questions? Okay. Any questions at all about any of it?
Yay.
All right, if not, thank you very much.
Wonderful presentation. Thank you.
Thank you.
Any questions at all? That means you did a great presentation. There was no confusion.
Okay, good. Thank you.
All right, we will move on to director's report.
I'm sure Dave has a question.
Thank you, Hannah and Hartley, for your great presentation. Really wonderful information, and again, so grateful for the partnership that we have between our agencies. And I know, Kate, you're here as well. If there's anything else that you wanted to add from a health standpoint, beyond our public health programming, this would be a great time.
Yeah, well, I can just take a couple minutes. First of all, I just want to express my gratitude to Courtney and Hannah as clinic employees who also spend the majority of their time working with county programs. They have to navigate a lot of different worlds, a lot of different numbers and systems, and then you just send them an email and say, hey, can you guys present at the county at the PHHS meeting on this date, and boom, there's a beautiful presentation, and it just happens. And so I'm very grateful for their skill and their ability to do that, because it makes everything else that I do, and I'm sure what you guys do, easier too. I had also offered to come and just give a quick update about the pharmacy project, which is very brief because we're still early in the pharmacy project, a sort of year-long period, but I can just speak real briefly to that. I don't know if there are any particular pharmacy questions that anybody has, otherwise I can just do a quick recap of where we're at. All right, so basically we're still looking at a goal of January 2021 to have a pharmacy within the bounds of the clinic. We had decided to do that as the press release that we sent out a few weeks ago said, because there are quite a few advantages to having the clinic run a pharmacy. There are several federal programs that are easier to manage when we are doing them, and also we just felt that it was the best thing for the community. So we are working with a professional group called Cardinal Health. They are specializing in putting these pharmacies within federally qualified community health centers, because we have a special kind of red tape because we're a federally qualified community health center. They can help us navigate that. And so we've been working with them, and we're working with DSGW Architects down in Duluth to get the drawings of the pharmacy finalized. Once we have the drawings, that's the first step in walking through all those levels of licensing and such. The biggest question people have generally had, overall we've had extremely positive interactions with the public about the pharmacy project. The pharmacy will be available right off the atrium of the clinic. That's the number one question we've gotten from people. That's where it will be located. The exact outlines, the exact design is still what we're working with DSGW about. However, we know for sure that that entrance will be right off the atrium, very conveniently located for anybody who's coming in and out. And that's really where we're at right now. I'm happy to come back and give a more robust update when I have more things to update you all on. Any questions about that?
Any questions?
Thanks for the update.
Thanks for coming.
Thank you again for being here this morning. Nice to see you all. And just want to recognize as well that we have Grace Grenager here in the audience. Grace is a key part of this successful partnership with the Sawtooth Mountain Clinic in her role as public health coordinator. So thanks for being here, Grace. Ready for me?
Go ahead.
Okay, well, I'll start with an update on the proposed changes to the SNAP program, the Supplemental Nutrition Assistance Program. Commissioner Deschampe, at our last meeting, asked for a status update. Following the meeting, I sent an email out to the board just summarizing the status of the 3 different proposed changes. One of the recent changes is related to a lawsuit that the state of Minnesota entered into in January, joining 13 other states against the USDA regarding the proposed changes as related to the able-bodied adults without dependents clause or policy within the SNAP program. The effect that this would have within Cook County would be for those SNAP enrollees who are residing on the Grand Portage Reservation. Cook County historically had been under a waiver. The proposed change is impacting states' abilities to apply for and qualify for waivered status from time limits for the SNAP program. So any adults who do not have dependent children in the home, don't have any barriers to work, are limited in the number of months of SNAP that they can receive within a certain time frame. Again, historically, Cook County was a waived area because of our unemployment rate. That waiver was lifted in October of 2019. 19. Allison Plummer's here to back me up if I get anything wrong. No, however, the Grand Portage Reservation is still a waived area because of the employment rate there. This policy, which would go into effect in April, would also lift the waiver for the Grand Portage Reservation, so it could impact the length of time that residents of the reservation are able to receive SNAP. DHS is working to determine impacts of the final rule and communicate that regularly to counties and tribes who administer the program. Again, Minnesota is a part of a lawsuit against the USDA over the final rule, which may result in a temporary injunction. So again, DHS is monitoring the status, communicating regularly with counties and tribes, and working on a training plan for counties, regardless of whether that temporary injunction goes into place. So at this point, we're just watching and waiting with the potential of an April 1 effective date. The two other proposed rule changes for the SNAP program are related to broad-based categorical eligibility, which impacts asset and income limits for the SNAP program. A third rule change is related to standard utility allowances, so how an individual's utility expenses are calculated against their income in determining the SNAP benefit. That would also have a proposed negative impact on eligibility in terms of less people qualifying for SNAP because we have a higher utility allowance in Minnesota because of our high utility expenses. I do not have an update on either of those proposed rule changes, but we'll continue to share information as it's available.
Any questions? We have experts available. All right. So we'll just hold on to our seats and be excited for April Fool's Day.
Watch and wait. There's a lot at play, including state and federal budgets and policy changes, so watching and waiting at this point. But welcome any enrollees or members of the public who have questions to contact our agency. The legislative session kicked off last week. Just a few updates based on some of the priority areas identified by MACSA, which is the State Social Services Administrators Association. One of the big topics going into this session is the SUD reform changes at the state and federal level, substance use disorder reforms related to how counties are administering the chemical health assessment and providing treatment services to persons with substance use disorder. One of the changes or one of the proposals at the state level is to allow current assessors to continue to conduct assessments through July of 2022. One of the concerns expressed by counties is the lack of qualified staff to be able to provide the comprehensive assessment. That with SUD reform, there have been significant changes in terms of the qualifications for a qualified assessor. Here in Cook County, we do have a licensed drug and alcohol counselor, Greg Barnier, who does meet those requirements, but on a statewide level, in terms of a long-term planning process, having more flexibility is an identified priority of state social services agencies and the Department of Human Services. County lobbyists met last week with Representative Liz Olson out of Duluth, talking about how to navigate the issue related to incorrect payments cited by the State Department of Human Services to counties. So this is still in a planning phase, talking about how to draft a language into a bill that would hold counties harmless for those billing errors that were cited late last year. Yes.
Did you get any feedback or pushback regarding not, well, just following AMC's advice with those payments? And
I did not.
Nothing, no response. Oh, interesting.
Other than DHS simply confirming receipt of our response. I
Sure.
think they were grateful for our response,
Yeah.
but nothing specific.
Thank you.
From a public health standpoint, one of the LPHA, or local public health priorities going into the legislative session, as Hartley mentioned, is statewide conformity for tobacco policy to conform with the federal tobacco policies. Any questions on the legislative updates before I move on? I'm following our clinic staff's lead on pausing for questions after each topic. That seemed to go
Well
really
done.
well. All right, staff and agency updates. I don't have much to share this morning, but I simply wanted to give you an update on some of my own plans for my upcoming leave. I do plan to be out for 6 weeks, starting in mid to late April, and I'm doing some planning work internally with the management team of PHHS supervisors, Grace and Sarah, and Rena as well, to just have a really well laid out plan for those few weeks that I will be out of the office. It is likely that I will miss 2 PHHS board meetings. What I will propose is to have a written agency and staff update report to submit with the board packets, and then would be available to address any questions after the fact.
Will anyone be here in place of you?
Not in this seat. We'll have our staff updates. As is typical, the supervisor will likely attend with the staff who's presenting. Sarah or another staff person will be here to take minutes. But again, the types of things that I would typically be reporting on during this portion of the agenda, I would have prepared in a written summary as a part of the board packet. So you would have a chance to review that in advance, reach out to me for questions, and then we could follow up after the fact.
We could also Skype you in and get some more baby time.
That may also be an option. I will be back after 6 weeks part-time as well, so available in the office and doing some work from home as well.
Excellent.
Yeah. We have several other department staff who have anticipated leaves upcoming, so working to plan around that as well. We don't have any plans to bring on temporary staff, as was often the practice and the case in the past, because we have a little more depth within our teams because of the timing and the individual staff who are expecting to be out. We anticipate that we'll be able to manage during the short time that there's any overlap with multiple staff being out, with cases reassigned, and again, really doing the work in advance to plan out caseload assignments for those staff who do serve clients directly, and then in my case, and as with some of the supervisors, ensuring that meetings and other more administrative responsibilities are delegated or covered during those times.
Excellent.
One of my priorities before going out on leave will be to introduce a draft job description through the Personnel Committee for the Public Health Educator, which is a position that was included in the 2020 budget. Grace Grinagra and I have been meeting to finalize that position description. We'll likely be bringing that before the Personnel Committee and before this board in March to approve the position description and to authorize, to get your approval to post that as well. Allison Plummer is here. As I mentioned, one of our items for board action this morning is related to updates to the county's healthcare access plan, which is related to our administration of a transportation reimbursement program for medical assistance enrollees. So I asked Allison. Allison offered to be here this morning to address any specific questions you might have before approving that policy. And I'm happy to address any of the other items for board action if there are questions as well.
Any questions for
I guess that's
Allison or Allison? Do you want to just give us an update on the biennial healthcare access plan?
Sure. Yep. So as it kind of implies, biennial, we have to do this every 2 years. It's a requirement by DHS. Kind of formalizes, there's already a policy in place provided by DHS when it comes to administering this healthcare reimbursement program for those on medical assistance, but we formally as a county, all counties have to have the same policy in place, and then also provide any other stipulations that we may be imposing in regards to this reimbursement program. And then our policy, along with basic state policy, has to be approved every 2 years. And then in response to the policy that we submit, we also have our own little drafted policy in-house that we send out as part of our informational packet to medical assistants enrollees that provide them the basic information about the reimbursement program. And then there's like a voucher, like a little template form that they fill out. They submit receipts, things like that, to be eligible for reimbursement. So there's not many changes throughout the years. There was just one additional change that DHS required us to add to the policy this year, which then prompted us to make a slight change in our own in-house policy. We call it the really pretty salmon colored paper policy. That, again, this goes into an informational packet that we send out to medical assistants enrollees. So I'll just highlight that one change. So DHS, when it comes to meal reimbursements, they set a time frame that someone has to be in travel status for medical service, for a medical appointment, in order to be eligible for potential meal reimbursement. So for breakfast, they would have to be in travel status before 6 a.m. For lunch, they would have to be in travel status between 12 and 1, and travel status for dinner after 7 o'clock. So I think very similar to even like the policy that we have here for employees on travel status. They required a stipulation that we also add a mileage threshold to that someone has to also be not only travel in that time status, but they also have to be traveling a certain distance as well from home for that medical appointment. And then, so that kind of reduces those situations in which, say, someone is traveling from Lutsen to Grand Marais and their appointment's at noon, for example. Well, they could still eat lunch before they travel to town. So applying that minimum mileage just ensures that people are traveling a longer distance and really do need to have a meal reimbursement, like they stop in Two Harbors at Subway because they have to go to Duluth for an appointment. So it's just kind of limiting the liability in those meal reimbursements for people who really are traveling longer distances and are really not capable of eating at home, for example. So I guess I should clarify what we did for the mileage. So we actually did previously have in our own policy that someone had to be traveling at least 35 miles from home. We've increased that standard to at least 60 miles one way from home, paired with that time frame in travel status to be eligible for meal reimbursement.
Excellent. Any questions?
Who set the meal rates?
The meal rates, breakfast is $5.50. Lunch, huh?
What are you going to eat for that?
Well, yeah, are those?
Yeah, they're not meant to be 100% reimbursement. They haven't increased those rates for quite a long time.
That's a state set.
That's state.
Yeah.
Mm-hmm. Yeah, we can't change those reimbursement rates, but it helps. I mean, same with the mileage rate reimbursement. The base is 22 cents. I mean, that's a partial reimbursement. They're not meant to fully reimburse everyone 100%, but it's supposed to help offset the cost of traveling for medical care.
Any other questions? Can I get a motion?
So move.
Support.
Thank you. Any further discussion? All in favor?
Aye.
Any opposed? Passes unanimously.
Thank you.
Thank you, Allison.
Thank you.
Heidi,
Yes, ma'am.
I have to excuse myself because my
'Kay.
son has a fever.
Okay. That is quite all right. We've done all our board action items.
It's better than
All right, Allison, do you have anything else to update us on?
No, I'll just say that between Roger and I, we should be able to cover the local advisory council for mental health Heidi, as well. We were all there, so.
Excellent.
Yeah, no worries.
All right, we will move into committee reports. Commissioner Mills.
We meet tomorrow, AOA.
How about the next one?
AHA, we met, and kind of a lot of the discussion was, so AHA had been having kind of low usage of the Birch Tree Center, and so we were looking at some of the barriers of why isn't this getting used, and now we're looking at the usage is up, which is great. The new challenge is that it's uncompensated usage, and so navigating that and just why is it uncompensated, where are the people coming from, why are they there, and then how is there's a new facility being built next door, Birchwood, which will be longer term care and housing, and so how that's going to play in was all part of the discussion. So right now there's no statewide standards regarding the uncompensated care and just how it all plays into the usage numbers, and so we're looking for a little bit because anyone can come to that facility from the state, and so we're trying to find out if there's some kind of standard that can be put in place to.
So that name Birchwood's set in stone. Should be birch bark. It's gonna be confusing for us to have two Birchwoods.
Birch tree.
Well, and just the birch tree.
The new facility.
Yeah, there's the new one that's Birchwood
Oh.
next to the birch tree.
Yeah.
So
Realize they had a new one.
I don't know.
Yes.
I don't know the first thing about the naming, but I had a similar thought, not about our Birchwood, but just about birch and birch right next door.
So maybe it should be cedar. Cedar tree.
I
There'd
didn't.
be birch trees all around.
No longer, I don't think, but maybe, I don't know.
Is it Center Cities doing the housing one?
Yeah.
Okay. Are they taking people from Wisconsin?
In the data, I didn't see Wisconsin. I think more what I saw was other.
Oh.
So I think it could be. I don't recall anything from Wisconsin in particular.
It's most likely reported as generally out of state, but
Yeah.
likely that.
Yeah, because
of
they do have
proximity.
Metro, but not.
Just wondering about the uncompensated, because I know they had to shut down the Wisconsin pipeline there early on, and just wondered if that had reopened. 'Cause they were having people coming over from Wisconsin, and it was,
Oh,
couldn't
okay.
get reimbursed for it.
Yeah.
Interesting. Well, keep us updated on that.
Yeah, I think it was more of St. Louis County
Okay.
numbers as far as the sheer usage of it. I don't,
But the uncompensated is what I'm thinking of.
yep.
When will the new section be ready? New building?
I don't, the Birchwood, I don't even know that timeline.
That's good, I'm glad to hear it's going.
Yeah,
That was part of the original plan.
okay, yeah, and, I'm not, that's about the extent of what I know about it. But that it should help having that kind of system in place, the two next to each other, and, learning curve for new facilities as well. So there's been some challenges with the building of Birch Tree that are being addressed, and so hopefully those won't come up in Birchwood.
That's too bad, because that was a really nice, such a nice building.
Yep, it still is, and yeah, I think there was some really odd, I think it was just venting of plumbing that was to code, but was still having issues or something like that, and, yeah.
One more question, is Region 3 still paying for the uncompensated care?
I think that's where, I don't know that either. I think that's where kind of this whole discussion is coming from, is who's paying for that? Where is that coming from? Is that coming from Birch Tree? Is it coming from the state? Is it, just, it's all unknown.
I remember correctly, Region 3 was picking.
All of it up, or, okay.
In the beginning.
Mhm.
I don't know if it still is.
I believe that it's state-granted funds to the region that are used to offset the cost of uncompensated care.
Sounds right.
Okay. Man, sorry, I don't know more on that. That's all.
Thank you. Commissioner Deschampe.
We meet Friday.
Okay, Arrowhead Regional Development, Commissioner Storlie.
We meet Thursday.
Community Health Board, Commissioner Mills.
Oh, let's see. Yes, we did meet, and our new director, Susan Michaels, joined us for a little bit. She's not on the job yet, and she's going through transition, but we'll be there for the next meeting, and I guess that's kind of by and large the big takeaway there.
What does going through transition mean?
She is currently working, and then will be joining as the director, and so she will be transitioning jobs from her current position to the director of the CHP.
Okay.
So Susan is currently a State Department of Health employee.
That's okay. Next is Public Health and Human Service Advisory.
Not a lot. We haven't met. We'll be meeting next on Tuesday, the 3rd of March. And thanks to Allison for reminding me. We'll be reviewing proposed changes to the bylaws to ensure consistency with state statutes. We're going to discuss committee recruitment and have a presentation from Mike Keyport and Grace Grittiger on the emergency management and public health emergency preparedness. We also have a standing agenda items that include committee reports, agency and provider updates, roundtable discussion, community updates.
Okay, you and I have talked about emergency preparedness.
Mm-hmm.
Is this kind of an extension?
Along those lines.
Okay, excellent.
After going to their meeting, and also I believe it was in one of the board meetings, hearing people talking about emergency preparedness and emergency planning for events, and some having it, some not. It just seemed like a good time for us to talk about it. See what we can help with.
Right. Excellent. Will the entire Emergency Preparedness Committee be joining you, or just
No, it's just
Mike and Grace?
Grace, right?
Mike and Grace, and the goal is really to give an overview of emergency management, public health emergency preparedness, how those intersect, and then opportunities for the committee, as Roger and I discussed, for them to learn more about the public health role and how the advisory committee can be an advocate and support and learn more.
This is
another committee.
Yeah, this is absolutely wonderful. Of all of the negativity surrounding the border to border, the steps that we're now taking and moving forward on is a plus to the community. So thank you for your group bringing that forward and your work on that.
Try to be positive.
You know that's where I'm at on this.
So we're at.
Any questions for Roger?
Not for Roger, but going back to ARC, I was in the Northeast Minnesota NEMOJET meeting, and the bulk of the meeting was just commissioners on that board giving updates. And Carleton County now has a letter mandating that they build a new jail. And so they were kind of wrestling with that issue.
Who sent the letter? DOJ?
Yeah.
Okay.
And so they're looking at a $40 million project. And they're also looking at pulling out a NERC. And I didn't know if there had been much talk at
That's
ARC.
one commissioner that wants to pull out a NERC.
No, from Carleton?
Yeah.
Oh, okay.
Dick's been on the NERC board for 26 years, so.
Okay.
Commissioner Brenner.
Oh, okay.
And
And that's not who I heard it from, but
Yeah.
it's still, okay.
And what's the reasoning of the letter? What deficiencies did their facility have?
We didn't get into those specifics.
Okay.
But one thing that's very interesting that really caught my eye, I mean, the whole thing did, but in particular, they're looking to use local option sales tax to do that. And so they will be approaching the state to get permission to do that, and so is another county. And I just thought that was a really interesting.
They probably have room to do that. We've maxed out our local capacity sales tax here. We've got the 1% that's been rolling for years.
Yes, but it's just really interesting, the steps that they're going through and the challenges. And also, in order to qualify for that, they would have to be regionally significant, which they might be competing for that regional significance. So it's just really interesting, though, to hear of what
Well,
else
it's
is
interesting
going
that they
on.
received a letter, because I know Lake of the Woods also received a letter that they needed to, and the deficiencies in their facility are the same as the ones we have in our facility.
Mhm.
So,
I did some inquiries on that when we were looking at the jail issue here, and I know one of the significant factors in Carleton County is they lack facilities for female inmates.
Yep.
And so that's sort of driving, I think, the Department of Justice is, and it does affect the regional thing, but not NERC. So it's for male, isn't it? So it's going to be interesting.
Yeah, and I think
Excuse
that's
me.
what they're leaning on for the regional significance is the female population.
And there could be something to that.
But so is, I think, was it Itasca is also, I mean, it was just.
Yeah,
really-
they just
I have
have-
some notes I can bring, but.
yeah.
They just don't have the capacity,
Mhm.
that task, from what I remember.
Mhm.
So then will they also be, since they have to address female populations, will they also be able then to address other populations that are not specifically male and female?
You would think if they're building, they would
Okay.
think ahead.
Because that has been brought up in a few meetings.
Mhm.
All right, is that,
Yep, sorry to backtrack there, I just didn't know if you had heard.
that's
heard
quite
more.
all right.
I
We are,
think the DOJ is talking about bringing the prison population down and releasing people, which is going to put more expense on ARC and to monitor these people.
That's another way to address
Into-
that, huh?
But it's just more expense.
Yeah.
are they talking about integrating them into more of the social justice programs?
Possibly.
I mean, that's what's reduced our numbers here, is the work and effort we've put into that. I can't imagine they're just gonna release them. Fly away,
I
little
think
birds.
they're trying to bring the
Yep.
DOJ's cost down, but then they're just putting that cost
Pushing
on the
it.
counties, so.
Okay.
That's the way it usually goes.
Yeah.
Yeah.
All right. Allison, you want to take the next one?
Sure, I took minutes at that meeting, so I have those right in front of me. The local advisory council met on Tuesday, February 11th. We had a large group. Almost everyone was in attendance. We welcomed a new member and a guest. As is the case with our advisory meetings, one of the best parts of the agenda is our community roundtable discussion, because that allows things that are timely or are of concern to individual council or committee members to emerge. So that's always a very productive discussion. One of the things that came up in our January meeting was about changes to the local ECFE program because of staffing, what that means for young families in terms of having that connection and social support, the things that Hannah was talking to us about this morning. So we were able to get an update from the school about a temporary plan in place to ensure staffing coverage by bringing up a certified instructor from Lake County. Again, one of the benefits of our partnership with the superintendent there is that we're able to access resources from our neighbors to continue to offer that program here in Cook County. One of our committee members is the outreach coordinator for higher ed, so she reported on a number of trainings that they have upcoming, talking about genocide and peace building, workshops related to historical trauma and unconscious bias, and how these are really important considerations as we talk about mental health and mental well-being, especially because of where we live. Let's see. We received an update from a work group of the local advisory council. It's a work group that's looking at service mapping within the behavioral health service area, looking at breaking down services by targeted populations, so looking at services for children and adolescents, sort of services for adults and aging adults, and looking more comprehensively at services, not just in terms of the deep end treatment services, but what are the programs and services within the community that build mental well-being and resilience, and how do we talk about those as well as being equally important in many cases. We heard about an opportunity that the PHHS department is coordinating with the Minnesota Department of Health. A media release will likely be going out later today or tomorrow to publicize this to the community at large, but it's a hosted webinar here in the Cook County Courthouse each month on the last Tuesday of the month. And it's to connect in with a statewide webinar on, it's called the Minnesota Department of Health Wellbeing and Resiliency Learning Community. So each month there's a different topic. We again will make the space available here in the ITV room just across the hall, and we'll help facilitate a discussion with anyone from the public who's interested in attending. So this month's topic will be about the role of nature in child development and child well-being and resilience. I don't have the exact information in front of me, but it will go out in the media release. We also talked about our next few meetings and the types of agenda items that we want to cover. Even though that group is meeting monthly, we have a long queue of topics that we're interested in covering. So just really grateful for that group. It's not even been a year that it's been established, but really engaged, wanting to do more to support the agency and the mental health system in Cook County.
Roger?
I was just going to riff off what you said about the nature, youth and nature. After that meeting, there are 2 members of the Library Friends on that committee. So we happened to meet the next day for the Library Friends, and the Library Friends is going to work with the local library, which I don't even think the library knows yet. But we would like to come up with a way to start moving towards a nature-smart public library, as they do in St. Paul. And what they do in St. Paul is they do like backpacks full of things that families and kids can take out into the community and find around, like scavenger hunts and things to do out in nature within the city. And some of the, like one of the libraries in St. Paul built a mason bee house, for mason bees so that they could do better in surviving. So I think the way we're going to start, it's a very small committee, but I think we're going to start out with putting together some sort of scavenger hunt for this summer, so that kids locally and families locally, as well as families from without the area, will be able to go out into the community and look for, geodes or whatever, and just kind of get a feel for the nature in this community and get them outside. So
excellent.
That has nothing to do with this committee or that committee, but it's just something kind of that grew out of our meeting. So it should be a good thing.
My cousin's child goes to the nature daycare that was recently developed here, and one of the outcomes of that is she said when they're home, they don't want to be inside.
That's good.
So they want to be outside playing.
I should also mention that the group talked about an outreach initiative for May, which is Mental Health Awareness Month. The group at our last several meetings talked about the power of storytelling when it comes to people as individuals telling our stories about how our lives have been touched by mental health, how mental wellness and mental well-being is a part of all of our lives and our holistic health. So one of the ideas that the group came up with was to work with WTIP on a First Thursday community conversation. I did reach out to Joe. I have yet to share this with the group, but I'm happy to share that he confirmed that would be available, so we'll be working on planning that at our next agenda as well.
Awesome.
Yeah.
Yeah, we talked a lot about making the conversation normal and having a face to it, having people in the community that are willing to talk about the fact that they have a mental illness and that it's not so scary. So that's a great news. Thank you. Thanks, Joe. All right, we will move on to healthcare planning. Commissioner Storlie.
I was not able to attend, but I have very good PowerPoints. written up after the meeting. Allison was there too. So I'm just going to pick out a few things. There was discussion from Care Partners about increased requests for transportation to medical appointments and procedures, and it continued on with general conversation about, how locally is transportation handled and what kind of resources and challenges could be discussed on that. Sawtooth Mountain Clinic has hired a director of nursing, Afton Bonnen. They're still seeking, though, 2 additional RNs. North Shore Care Foundation are working on a website and capacity building, but also children's mental health, which I thought was very wise and very timely, of course. So that's the highlights. Because I was absent, I sent in my comments too, which was reported.
Excellent, thank you. North Shore Collaborative, Commissioner Mills.
Yep, we met and went through the first quarter grant applications, and one of the things coming out of, I guess, last year's process is just that we decided that it would be good to get to have, when people do a grant report, to include receipts of expenses, which seemed like very, very smart due diligence there. So it's just interesting how things can take time to evolve, and this. I guess when this first got going, they had grants, a grant budget of like $200,000, and now it's down to about $36,000. So it's just really interesting how things change and how things develop there. So
Excellent. Allison, we need to change emergency preparedness to Bursheim
Yes.
and Mills. Do either one of you have an update for
yeah,
EDC?
yeah, we were there, and that was my first meeting for that. It was didn't know what to expect, and it was good. It was great. Got some updates on the coronavirus, and of course that's old news now. We know more, but there was a lot more unknowns at that time, so it's just kind of getting the rundown, and I guess that was my takeaway, just learning who's in the group.
We did our typical round robin, sort of what's going on and various entities that are involved in this group, and we briefly talked about the border-to-border issues and how it applies especially to fire safety. So Michael Croteau was there, and he had some comments on that, and regarding more patrolling and so forth, if that went through. Basically, that was it. Did I recall?
Roger?
Go back to the North Shore Collaborative for just a sec.
Sure.
Yes.
Are they going to continue with the LOTS program?
Yes.
Both Grand Portage and
Yes.
Cook County and the other? Good.
Yeah.
That's good. That's a great program.
Yeah.
What is
And
it?
The lots, getting the books out to young readers and families, and my understanding is just before I joined that board, being elected, they had a new staff, and trying to just get everything organized from years past, and so there was more of an inventory and just more of it just seems a lot more organized than what it was, and so I'm hoping to see a lot more of that too. So
I really hope they keep the LOTS program going, because it's such a wonderful way to get kids and families involved in reading.
I'll pass it on. Thank you.
All right, does anyone have anything for the good of the order?
6 p.m. tonight at Oshki, there's traditional Ojibwe storytelling.
Cool.
And is that open to anyone?
Yeah.
Excellent. And where's that at again?
At Oshki, the charter school.
The charter school.
Doing the stories.
Jourdain from Lac LaCroix and Standing Cloud from Red Lake.
Cool.
And Bobby has a flyer on it if anyone is interested in seeing that.
Is it a regular thing, or is this like a one-time
It's
event?
the second annual.
Cool.
And my, for the good of the order today, is to thank all of you for your participation and input, and the fact that you speak openly and freely with each other and carry on conversations for better understanding. So I would like to thank all of you for your participation in this meeting. It's greatly appreciated that we are able to not be so rigid. So thank you all. And with that, we will adjourn.
So our meeting date for next month is the
March 7th.
March something.
Is it 17th? There's an extra Tuesday in there. Is that